If I could have everyone's attention. Welcome to this historic event here at St. Vincent's Medical Center in the great city of Bridgeport as we take a momentous step in our battle against COVID-19. And I think it's appropriate to reflect on the founding of St. Vincent's and how that fits into what we're doing here today. St. Vincent's was actually founded in 1903 when a group of doctors asked a local pastor to come and build a new hospital here in the city of Bridgeport. So for 118 years, there's been an intimate connection between St. Vincent's Medical Center and our faith community partners here in the greater Bridgeport region. And that's an integral part of the work that we do and our commitment to this community. And it's a commitment that continues in our wonderful affiliation with Hartford HealthCare. So we are thrilled today to have 9 pastors from the greater Bridgeport region who have courageously volunteered to come out in the cold and get vaccinated. We appreciate that. And the intent and what's so powerful about all of our pastors coming together as a group is that they are the trusted leaders in their community. And they will carry the message forward that getting the vaccination is the right thing to do, is the safe thing to do, is the appropriate thing to do. So again, thank you today. So, yes, it is worthy of applause. So it's my great pleasure to introduce a close colleague and friend for many years here in the city of Bridgeport, the Reverend Carl McCluster.
Greetings and thank you for being here. I would be remiss if I did not first acknowledge the presence of God in this place. This is my hospital. This is where I go if I'm sick. And the partnership that our church has had with St. Vincent's and now the healthcare community spans more than 25 years. From when Rick D'Aquila wanted to build or get housing subsidies and programs for employees so that they could walk to work instead of having to drive through the snow. Also, I have to acknowledge the presence of my colleagues who are bravely stepping forward today. I'm going to ask all the pastors if you would stand right now let's give them a round of applause. The president, I'm going to name them too. I'm going to take a moment to name them. Is Pastor William McCullough, pastor of the Russell Temple CME Church, president of the Interdenominational Ministerial Alliance of Greater Bridgeport and vicinity, and also founding pastor for Faith Acts for Education, educational advocacy firm. I want to recognize Pastor Yolanda Hernandez, who's the pastor of the Latino Evangelical Pastors of Greater Bridgeport and vicinity, and her husband, who is one of the foundational leaders of this community, faith community, Bishop Hector Hernandez. Thank you, Bishop, for being with us here today, and Pastor. Next to Pastor McCullough is Pastor John Diamond, the pastor of Cathedral of Faith Church, 2319 Fairfield Avenue. I've been there too many times. But Pastor Diamond is also a board member for Faith Acts for Education and one of our leaders in the Caribbean American community and the broader community overall. Pastor Brenda Barnes, who is the pastor of Gospel Assembly and the vice president of the Interdenominational Ministerial Alliance of Greater Bridgeport and vicinity. Next to her on her left is Elder Barnes, who is actually one of those people that just goes out and gets it done. You know, there are people that go fearlessly into people's homes and giving things and food and all this other kind of stuff. Thank you, Brother Barnes, Elder Barnes, for your leadership. To her right is the Reverend Dr. Sheldon E Williams. He's a He's one of those people, Governor, that they said is moving to Connecticut. He lives in Connecticut, in Norwalk, but he is the president of the Black Radio Broadcasters Association of America. And so this broadcast, what's going on now, is going to go out around the country through Dr. Williams and his affiliation. And behind him, Reverend Aaron Best. Reverend Best is a board member for the Council of Churches. And I have to say to Cass Shaw, who chose not to be here today. She's an Anglo woman who is not of age to get it yet. And she says, I'm not going to step in front of the line. We need to get the people that we serve helped. These are your clergy leaders who are here today. I want to give God praise for them and thank you. People say, why the vaccine and why now? Well, let's do it statistically first. 500,000 people who have died from COVID-19. I did my own research, didn't wait for fake news to show up. Nothing against anybody here, of course. But when you look at the number of people that have died after a COVID-19 shot, all other factors considered, there is a 1,000% greater chance of dying of COVID-19 than getting sick or dying from the shot. Think about that. So for those people that are placing their bet somewhere, then 1,000 times more likely to die from COVID-19 than from getting the shot. I'm getting my shot, and I'm getting it today. And I encourage people to understand that great work being done by Hartford HealthCare to debunk this mystery. How did it happen so fast? How did we get it so fast? You know what? This healthcare community has come together in a way that they never could have before when we had polio and other sorts of vaccines. Now, the communication links between the medical community, the money that has been put up front, instead of having to research and figure out what's going to work, the money is there now to do the research and to come forward and to get this vaccine out. And so we're grateful, Jeff Flaks, for all that Hartford HealthCare has done, not just here in the Bridgeport community, but around the state, and as a leader in this nation to deal with the racial inequity that COVID has brought to bear and brought into light. So thank you, Jeff, and thank you, Hartford HealthCare, for all you're doing. And last but not least, I have to give kudos to the governor. The governor and I fight about a lot of stuff. We disagree. We disagree on a lot of things. Some of y'all have heard me disagreeing with the governor, but you know what? We agree on this. It's time for us to step up and take care of the people of the state of Connecticut. It's time for us to lead the way. Connecticut is a leader. We are the Constitution state. We are the originals. And so we are leading now in how we disseminate and distribute this vaccine throughout our community. And the presence of I call her pastor, she's the CAO of the city, Janine Hawkins, who'll speak for the city today. We pastored on the same block, you guys, in the South End. And the leadership and the humility that she's shown with all the criticisms of the city in this process, I give kudos to Janine Hawkins for her leadership in this city as well. So that's really it. I'm going to get out of the way. You've heard the statistics. You've heard the research. All I say is, you know, we have a saying at Shiloh that we started, God gave us at the beginning of this process. It is fighting fear with faith and facts. It is time for us to fight the fear of taking this vaccine, to fight the fear of COVID, and emerge boldly as a community and as a people to rise up and take back our lives and to take back our lifestyle. And for us, it begins right here with these COVID shots today. Thank you.
Okay, next I'd like to invite the co-pastor, Janine Hawkins, to say a few remarks on behalf of Mayor Ganim and the city of Bridgeport.
Good afternoon. It is indeed a pleasure and an honor to be here with you today on behalf of Mayor Joseph P. Ganim. I cannot thank you enough, clergy who are well respected in this community, who are not just saying, but they're actually doing. It is our belief that everything rises and falls with leadership. It's one thing to say something, but it's another thing to do it. And so today we celebrate, we partner with the clergy, understanding that their voices matter. We thank Reverend McCluster, we thank the governor and his leadership. And the fact of the matter is that we are interested in saving lives. And every vaccine that goes into the arm of someone else will save a life. So again, we are excited because our lives are all changing and a life will be saved by this vaccine. And we are so excited that the clergy is setting the example of what we all should do. So again, it is an honor and a pleasure, and we thank you.
Next, I'd like to invite up one of our renowned doctors here at St. Vincent's, Dr. Fumi Falade.
Good morning. My name is Fumi Falade. I'm the Director of Critical Care here at St. Vincent's. And I am here because we stand together to take our lives back. About 2 weeks from now, it would mark the 1-year anniversary from when we admitted our first COVID patient to the ICU. He was young, and he looked like my husband. We have since learned a lot about COVID, and a lot of racial inequities have been unmasked. This is a time when we have to pull each other out of this. We should not miss our shot. With every vaccine taken, are many lives saved. In the year in the ICU, we have sat with families. We have sat with multiple family members within the same ICU. We have cried, we have celebrated, and we want to keep celebrating by recognizing a few things. We stand together. We can do this if we ask questions. All our questions have answers. We only need to ask. And the vaccine is safe and effective. Thank you.
It is now my distinct pleasure to introduce the President and CEO of Hartford HealthCare, Jeffrey Flaks.
Good morning. Let me begin by thanking our 9 pastors who are stepping forward today. This is about partnership. This is about leadership. The work that we've been able to do together, we're making great progress. And I'm so proud of the efforts that are coming together to address the disparities in healthcare in our region and in Connecticut. And it will be achieved by people like Pastor McCluster, partnering with organizations like ours, where we can create trust within our communities. Across Hartford HealthCare today, we have put 2 mobile vaccination teams in place off 2 mobile vaccination vehicles that will go out 10 times per week into the community. We need to ensure that we are bringing the vaccine to where people are. We need to be partnering with trusted leaders within our community who can help us deliver this vaccine. And we will be in homeless shelters, we are in churches, we are doing it in community centers, and we will challenge ourselves to use all of our skills, capability, ingenuity to bring this vaccine into the community as effectively as we possibly can. At the same time, we have created 7 mega centers across the state of Connecticut. One here at Central High School in Bridgeport, another at Sacred Heart University close by in Bridgeport, at the Hartford Convention Center in Hartford, also at the Infinity Center in Hartford, at Foxwoods, at the baseball field in Norwich, at the Torrington Armory. We're creating centers. We're creating transportation systems in place where we're sending out transportation into the community to bring people into these centers. In this moment, I pledge within Hartford HealthCare to use all of our strengths, all of our resources to bring this vaccine into the community. And it's truly being done through the best of Connecticut coming together. And today, seeing 9 pastors step forward as leaders, demonstrating with their actions in this moment the importance of getting this vaccine, it's absolutely critical. And I'm very grateful to Pastor McCluster for demonstrating that faith and facts. All right, we're going to bring our expertise, we're going to be accessible, we're going to be available to build trust, to build relationships, and demonstrate through our actions the ability to impact the disparities that exist within our communities, which must be eliminated. And we are committed to eliminating those disparities. It's my honor now to introduce the governor, and I can say from the very moment, and in fact 2 weeks from now, on March 14th, we'll be recognizing in Hartford HealthCare the very first patient that we admitted with COVID-19. And I remember that day like it was yesterday, and I spoke to the governor personally. Throughout this crisis, we've been shoulder to shoulder working with the governor. And I can say, without any doubt and without any question, his personal commitment to doing the right thing, to being completely accessible to us and the healthcare community, to working to get our input, to engaging us in a dialogue, and to ensuring that he's advocating on behalf of all people to ensure that no community will be left behind, is absolutely clear in every one of his actions and certainly within his intentions. So it's my honor to bring the governor here to St. Vincent's in Bridgeport within Hartford HealthCare today for a historic moment to see our 9 leaders within this community, our pastors, roll up their sleeves, get the shot, and demonstrate the confidence in the science and in the commitment to leading within our community. I thank you so much for your leadership, and thank you, Governor, for being here today.
Well, thank you for that kind introduction, and to St. Vincent's and Hartford HealthCare, what you're doing, making a difference. I love that sign, I got the shot. You know what they say in Britain? I got the jab. They say I got the jab. But either way, the vaccine works, it keeps you safe, it's effective, as Pastor McCluster said, but only if you get the jab, only if you get the shot. And it comes to vaccinations, it's not like Field of Dreams, you build it and they will come. We also have to reach out. And Pastor McCluster, I thank you so much for taking the lead on this. I appreciate the ministers being here, trusted members of the community, talking to your congregations, letting people know this is the right thing to do for yourself, your family, and your community, keeping them safe and keeping all of us safe. Thank you. God bless you for what you're doing. And we're bringing the mobile vans. We're going to bring them right to your churches. Make it easy for people. If they can't get to St. Vincent's, we'll come to you and do everything we can to make a difference. And you know what? It is making a difference. President Biden was Zooming yesterday. He gave Connecticut very kindly a shout out for getting more people vaccinated, not only quickly, but fairly and equitably, and making sure that nobody is left behind. And what that means in terms of fatalities. Look, a month ago, we were losing maybe 40, 45 people a day. Yesterday was 8 people. That's 8 people too many, but it's just as a reminder it's working. We were getting decimated in our nursing homes. They were the first to get vaccinated, and now it's a month later, and fatalities and complications way down there as well. It's just a reminder that this works. And we're working very hard, not just to make it easier for you to get vaccinated. Look, the worried well, they line up. They go to your mass vaccination centers. But going into the community, going into the most underserved community, going to the black and brown community, and I urge each and every one of you, get vaccinated and then tell a friend you got vaccinated and you worked and it lifted a burden off your shoulders and you feel more confident. And your child who's maybe working in food service or working in restaurants, now you can see them again because they can come home and they can see their parents or grandparents, and what a difference that makes. We're getting through this. We're making real progress as a state and as a country, but we're not through it yet. You know, I'm looking at some spikes in New York City. You remember we got hit in the New York City contagion 8 months ago. I think if we get vaccinated, we stay ahead of this curve, and it's going to be a really warm spring in Connecticut and beyond. That's only thanks to you, thanks to our ministers, thanks to Hartford Health and St. Vincent. Now, please, come get vaccinated. It's available, it's free, no questions asked. Do the right thing. Thanks, everybody.
I will stand with you. Okay, so don't run away. Okay. It's a unique opportunity for us. We have the governor here. I know people have questions, so the governor has graciously agreed, with the help of all of us here, to answer any questions that anyone might have.
We're doing better, not nearly good enough. We have a long way to go. I'll ask the ministers or Reverend McCluster. I mean, we got to do a better job of reaching out into the community, especially the African American community, the black and brown community. Tell them it's safe, tell them it's the right thing to do, and we've got to do a better job. This is true around the country, and it's true in Connecticut. I was just told we have a long way to go. We're doing better than we did 2 weeks ago, but not good enough. Yeah. Rob, you don't have that number, do you?
So I can answer the question. 8.5% of black and brown population have received the vaccine.
Okay.
Combined.
Yes, okay. And obviously, it's much higher for the white community, the worried well. And that's why we're working with the ministers, working with Reverend McCluster, reaching out in the community, bringing the mobile vans into your community, bringing the mobile vans to your housing, and doing everything we can.
The minister said what can be done. You're out here today. How effective do you think that would be?
I know it's going to be effective because we're going to go back to our parishes, to it's not just the black and the brown ministers, it's all of the ministers, all of the rabbis, all of the imams that are getting the word out to our communities. And we're going to go back to our pulpits, go back on virtual media this week and put out the message. It's time to fight fear with faith and facts. That's our theme. We're just taking it and running with it, and we're going to do that. We know how to get people elected. And so we also know how to get people protected.
President, can you talk about what some of the most common objections are in the black and brown community?
Sure, they're the same things that I had when I first heard about it. There's a history of experimenting with peoples. In the United States, of course, the infamous Tuskegee experiments, and also because of the level of average health for the black and the brown community is lower for many different reasons, some of them socioeconomic reasons. That's why I appreciate Jeff's statement about the challenge of racism and what it does to us in the healthcare industry. What a lot of people don't realize is that there were black doctors working on the design and the development of this vaccine. One of the primary people was a young doctor from Yale that was working as a part of the team to develop the vaccine. So that fear, ignorance is not being stupid. Ignorance is just not knowing. So when I say ignorance in our communities, we don't know. We're not in all of the circles of conversation, but through leadership like I named leaders here that are with us. These folks are in the circles of leadership in this city, and they're taking this message and the messages that Jeff and the governor and that, I keep calling him Pastor Hawkins, that CAO Hawkins is giving this medical community. Teo, who is one of your surgeons here, the trauma surgeon here, was out there at the Klein parking lot with us, giving out more than 1,000 bags of COVID supplies and good information, partnering with Netter School of Health. So we're busy about it. We're going to go back. We're going to get the information out. And then at the end of the day, people have to choose. Choose to be afraid, choose to be paranoid, or choose to face the facts. Not getting the vaccine is putting yourself at mortal danger right now. Taking the vaccine is protecting yourself and your family from having to go through what so many of us went through as pastors and ministers. We couldn't go into the hospital to sit with the people we love and have walked with for years and years because of the contagious nature of the disease. But maybe now we can be there like God has called us to be there with our people when they're in these difficult situations, not just COVID, but everything else. So I'm sorry to go on so long. It's passion for us. We're here because we care about our people. And I applaud those like the governor, like Janine, like Bill, like Jeff, and the doctors and the staff of this hospital, of my hospital, who are on the front line. A kid named Miguel, who was one of the first people, frontline workers, to get vaccinated. And Miguel and so many faceless people to us like them are dealing with people every single day and risking their lives. It's time for it to end. And the end begins with this beginning.
I know that vaccine diversion is a big problem, but what about the other problems? Are the churches organizing to help people get signed up who maybe don't have computer access?
Listen, come on, Reverend Hawkins. We had a great call yesterday with a couple of days, Pastor McCullough and Stanley Lord, the president of NAACP, and we've agreed to take advantage of Jeff's offer for the mobile vans to get out and to get into the community where people can't get there. Vans going out to pick people up. Come on, it's there. Janine, what do you?
We have 4 initiatives that we're doing. The first initiative is that we are going to have informational sessions throughout the entire community in various languages to reach all people. That's the first thing that we're doing as far as Zoom calls. We're partnering with, as we said before, with the clergy, with all of the organizations throughout the entire city. We are literally making the calls to each and every organization, every church that we have a roster for, and we're partnering with them. And the first question we ask them is, do you have the number? Do you have the number to register you and your members? That number is area code 203 576-9773. We say, okay, if you do not have that number to get help to be registered, we will help you register. The second thing we say is that, do you have transportation? Can you get there on your own, or do you need help? If you need help to get the transportation, we will arrange it right then and there to make sure that you get there. And then if you say, I do not know how to register, I do not have transportation, and I am unable to move out of my home, we have mobile units that we have set up that we will come to you to ensure that you will get the vaccine. We don't want any excuses. We don't want any reason for people not to get the vaccinations. So we are taking the bull by the horns, the city is, and we are serious about the people's lives and the black and brown people. I'm not sure, the governor may have another statistic, but what we do know is that we are making a difference, and that more people than before are now being vaccinated. And that our motto is and remains, each one reach one. It is necessary to have a personal conversation with people to convince them, to share with them why you should get the vaccine. I have had family members, I have had friends. Every other day I'm getting a call about somebody who has passed away from COVID. It is heartbreaking, and I know each of you have someone that you know that you have lost because of this deadly disease. So as Pastor McCluster has said, as Bill and Jeff and the wonderful governor has said, it is important that we all do our part. We will not be able to get out of this pandemic unless we partner together, join hands, and make this happen. So those are just some of the 4 initiatives that we're doing. And again, we're not saying that we're perfect. So if you have another way or a better way or another suggestion, please call us, tell us what it is, and we will incorporate your thoughts and make it happen. Thank you.
I just want to say this, and I'll get out of the way. it takes a partnership to make this work. It takes, at Yale School of Management many, many years ago, we said public-private nonprofit partnerships. One of the alumni is right here with me to make society work and to solve problems. And so this public-private nonprofit partnership between the church, Hartford HealthCare, and the governor and our government and our public officials, CAO Hawkins and the city, we're going to make this thing work. We're going to make it work. So I just want you to keep that in mind. I was going to ask you to say it one time. So in the African American church and the Latino church, we're a call and response church. In other words, we say something, God tells us something, we say it to you, and you speak back to us as your way of answering God. So I just want you to join me in our theme just one more time. Is that okay? I want you to lift your voices and say this. Fighting fear. Fighting fear. Oh, come on, you ain't fighting nothing like that. Fighting fear. Fighting fear. With faith and facts. With faith and facts. Fighting fear. Fighting fear. With faith and facts. One more time. Fighting fear. Fighting fear. With faith and facts. With faith and facts.
Amen. Feel better?
I was getting emails at the TV station about how difficult and using VAMs is to get.
So the question was about VAMs. That's the online way that you can sign up for the vaccine. We've got a new front-facing piece to it to make it a little bit easier, but let's face it, it's just not for some folks, it's not the way to go. That's why you heard from the mayor's office. We got outreach, we got reverse 911, we had the churches and others making phone calls. We're doing things where you can walk in and sign up to get the vaccination as well and bringing the vaccines to people. Look, obviously vans and online is the easiest way to do it. And I would tell you, people over the age of 65, we have positions open right now. You can get vaccinated. You can sign up either online or in person. And we got that because on Monday, 55 and older, it's available. Then it's going to get a little bit more crowded. And as I've asked a lot of people, 55 and over, don't all go to the front door at the exact same time. We can't handle that. So if you're feeling pretty healthy, if you were maybe infected, over the last couple months ago, if you telecommute, you don't have to necessarily go to the office or work every day. Give it a week or two so we can get rid of that first flow going forward. Look, all I know is we have two really effective vaccines that work and keep you safe and keep you out of the hospital and keep you from dying. And I think very shortly we're going to have a third, Johnson & Johnson, which is incredibly effective. So don't brand shop. Go out and get the vaccine when it's available to you. What bill is that? Yeah, I haven't seen the bill per se, but I'm sympathetic to what they're trying to accomplish.
Okay.
Thank you, everybody.
Thank you, Governor. Thank you for all those questions. And now we're going to get to what this day is all about, which is getting vaccinations to our very courageous pastors. So the first one on our list to roll up his sleeve, and he will come over, is Pastor Carl McCluster. All right, you go right over and get your vaccine.
Hey, listen, this morning when I got up, I prayed, and I said, you know what? If this doesn't work out for me, then 999 people will. How about that?
And so we can keep a flow going. After Pastor McCluster will be Pastor McCullough. So Pastor McCullough can begin to get ready to get vaccinated. Pastor Barnes and Elder Barnes. And they may want to come together for moral support.
Come on, guys, those glasses are real tall.